All right, how's it going, everybody? Dr. Dan back here with the Hypervolt, going through your how-to Hypervolt yourself. We're going to do the lower extremity below the knee, above the foot, that posterior and lateral or anterior leg compartment here. Very common area where people get shin splints, tendinitis, Achilles tendinitis, or the anterior compartment syndrome where we can get shin splints on the anterior or the lateral side, right? So there's many different causes to tendinitis, calf pains, shin splints, just general myofascial dysfunction of the lower extremity. It's important that you get evaluated and checked out, and you definitely work on strengthening and controlling the bigger muscle groups like the glutes and the hamstrings. The point of this video is to show you some simple at-home therapies, passive modalities that you can do to help promote improved circulation, reduce muscular tension, and just overall create some healthy tissue, okay? So we're gonna go to setting 2, and we're gonna first start with the leg crossed. We're gonna work on the medial gastroc and the foot flexors, right? And we're gonna start right on the back side of the tibia, which is your shin bone, right? This is where a lot of people will get tibial tendinitis, Achilles tendinitis. Ultimately, those conditions can turn into plantar fasciitis. And so what we're going to do here on setting 2 is nice and easily just move the Hypervolt right up and down the side of the bone, the tibia. And we're going to feel for any tender areas. The tender areas indicate that there's dysfunction. There's either muscular adhesion or fascial adhesion where the muscle and the connective tissue can kind of tighten up and get sticky on the bone. Sometimes tenderness and tension can also indicate muscular weakness, and so it is important to understand that this may not be the end-all be-all treatment for your lower leg problems. So we're working on the medial gastroc, which is your inner calf muscle. We're also working on the some of the foot flexor muscles that curl the toes. The soleus muscle, responsible for push-off and proper walking. And what I'll do at home, or my wife will do, or what we'll help patients to do at home, people that buy a Hypervolt for themselves, is number 1, with good upper body seated posture. We're just going to work on treating that entire muscle belly. The medial muscle belly here is what we're really working on, down into the thicker, more tendinous portion of the Achilles tendon, the soleus muscle, which rests much deeper against the bone, right? And just like we did with the foot, with the plantar surface of the foot, we can go through some active dorsiflexion, which activates and kind of tightens up that calf muscle as it stretches, or we can go through some plantar flexion to shorten the soleus, the Achilles tendon, and the gastroc. So active extension lengthens that posterior leg compartment, and flexion is going to shorten the tendons, right? Tendons and muscles. And once we go through some active extension for maybe 5 to 10 seconds, we go into our plantar flexion, 5 to 10 seconds, and then we can relax the foot and relax that muscle belly and find any of those tightened up areas that need to have a little bit of stimulation or circulation to help reduce some of the pain, right? If you've ever had like massage therapy, you know, sometimes the massage therapist or even a chiropractor or a physical therapist might get deep into the calves to help dig out some of the chronic tension that you develop, which is very common. Calves very commonly get tight and contracted from things like high-heeled shoes or just poor footwear in general. All right, next we're going to stand up against the couch or a table or a bench if we're at the gym, and we're going to take this Hypervolt to the lateral leg compartment, and a couple areas that we can hit here. is the peroneal muscles, which are your lateral dorsiflexors and plantar flexors and dorsiflexors over here. And this is very common where we get lateral shin splints, right? Some people may even develop peroneal tendinitis or even peroneal nerve entrapment, where you can have like numbness and tingling down onto the top of the foot, the top of the toes, which is very commonly due to compression of either the sciatic nerve up the back of the leg or the peroneal nerve and some of the other associated nerves on the lateral portion of the leg. So right in this area, very common space for people to develop hypersensitivity, pain, muscle dysfunction, and we're even shin splints, and we're going to use this Hypervolt to self-treat our calf, right? And we can bend the leg to really focus on that lateral compartment, or we can straighten the leg to get a little bit more posteriorly backwards on that back side of the calf. Again, plantar flex to activate, or dorsiflex slightly to stretch and relax. All right? So that's your Hypervolt how-to for the lower leg compartment, the side and the posterior leg compartment, which can help to reduce shin splints, Achilles tendinitis, any kind of myofascial dysfunction. If you're having ongoing issues or you're not sure how to do this, make sure you consult a healthcare professional, somebody that can properly diagnose you and give you the appropriate course of treatment or recommend the appropriate course of treatment to help heal your body. My name is Dr. Dan. That's your Hypervolt how-to for the lower extremity.